My name is Dr. Philip Mease. I'm a rheumatologist from Seattle, Washington, and Director of Rheumatology Research at Providence Swedish Medical Center in that city. I'm delighted to report on an abstract about Bimekizumab. Bimekizumab is an IL-17A and F inhibitor that has been previously approved in the treatment of psoriasis in the United States and has recently been approved for the treatment of psoriatic arthritis and axial spondyloarthritis. This abstract reported on two major patient-reported outcomes that are of great importance to patients. One, of course, is pain, but the other is fatigue. Fatigue ends up being a big deal to our patients, partly because it is a phenomenon that occurs in an increased amount in inflammatory diseases, and it has central brain mechanisms, and can be improved by treatment of the underlying immune disease. And thus, we saw both in pain and fatigue very significant improvements in the both biologic naive population or B optimal, and the B complete trial, which is in bio-experienced patients. So for example, improvement in pain. One of the ways in which pain results are reported in the pain literature are 30% or 50% improvement in pain. 30% being something that the patients can tell and is meaningful, and 50% being a really significant improvement in pain. And what was shown was that about 60% of the patients achieved an MCID of pain, and about 40% had this really substantial benefit. We know that this is a highly important outcome for patients, and showing that the majority of patients did achieve this is great. In terms of fatigue, there was an instrument known as the FACIT that was used to measure this. It has several questions. It's a composite measure. And there too, we found that a highly important improvement in fatigue occurred in at least 50% of patients. And this was sustained over time, over the course of 2 years, as was the sustainment of pain response, suggesting that not only was there a substantial effect that occurred relatively quickly, but it was durable. It lasted over time. Plus, this gives us important information to support the use of an IL-17A and F inhibitor in achieving goals that are very important to patients: improvement of pain and fatigue.